The Inspector General.
Chairwoman Kiggins, Ranking Member Ramirez, and members of the subcommittees. Thank you for the opportunity to testify on independent oversight conducted by the OIG on VHA's pause of its program integrity tool, which relates to HR 3483. Our testimony on this tool was requested by the subcommittee because the Fraud Act of 2025 requires VA to analyze community care claims using an IT system to detect overpayments and other fraud, waste, and abuse. This is something that the Program Integrity Tool did previously in a limited capacity. The Program Integrity Tool is a repository that consolidates data for multiple VA community care programs after a claim has been paid by VA. For revenue operations, VHA uses data from the tool to determine if veterans or their private insurance companies should be billed for care that is not service-connected. To support VHA's fraud and waste detection and mitigation efforts, data from the tool can be used to identify duplicate claim payments or indicators of potential fraud, such as payments to the same provider in different locations on the same day. VA paused operations of the Program Integrity Tool in February 2023 after becoming aware of ongoing issues with its database logic and unreliable data. The pause was intended to allow VHA time to evaluate the tool's processes, data, and its underlying IT system to determine the causes of any data errors and identify improvement opportunities. In July 2024, we issued a management advisory memorandum to VA leaders highlighting the major impacts of the tool's pause on VHA's revenue collection processes and on identifying fraud, waste, and abuse related to community care claims. In response to this work, VA officials stated that they had resumed using data from the Program Integrity Tool for revenue collection for claims, but were still considering the path forward for the tool's oversight functions, including audit and compliance efforts. While the tool was offline, VHA had limited ability to collect revenue of more than $660 million from veterans' co-payments or from private health insurers. This may negatively affect veterans because they could receive co-payments for bills that are well over a year old. The pause also affects the resources needed to address the significant billing backlog. VHA staff have been reviewing tens of millions of community care claims to determine which were billable for veteran co-payments or to private insurers. VHA will need to make certain that revenue operations staff has sufficient resources and processes to timely review and bill the full backlog of community care claims. Currently, the Program Integrity Tool is still not being fully used for the prevention, detection, and mitigation of fraud, waste, and abuse for paid community care claims. It is vital that the Office of Integrity and Compliance also have the needed resources to perform timely fraud, waste, and abuse examinations of community care claims to ensure the proper use of taxpayer dollars. In addition to the Fraud Act, many of the other bills under consideration require VA to develop or improve its IT systems. IT modernization has consistently been a major management challenge for VA. Our work has identified extensive breakdowns with upgrading or replacing key systems, as well as significant cost overruns. The OIG remains vigilant in overseeing all significant IT initiatives to identify all risks to veterans, their families, and survivors. To do this, IG staff monitor programs and operations for breakdowns in processes, for noncompliance with mandates, for failures to provide timely and quality health care, and for deficiencies in the delivery of benefits and services to veterans. We will continue to advance accountability by conducting effective oversight into how VA plans, implements, and remediates identified weaknesses in its system modernization efforts. This concludes my statement, and I am happy to answer any questions you may have.